It's great to be back at the old college. Can we believe it that we're freshmen 54 years ago? That's true, we really were. And they say the new 70 is the new 40, so maybe that's really where we are. This healthcare panel is focused specifically on ways in which we have improved or can improve access to healthcare. There are other panels today and tomorrow that you'll hear talking about other points of this. Is there anybody here who never gets sick? Raise your hand. Is there anyone here who never gets injured? Raise your hand. All right, so with all this talk about wellness and diet and exercise and the importance of keeping ourselves healthy, yes, that's important, but there is a need for a medical care system when we get sick. And I'm going to focus on three things today. Our emergency medical system and what's happened in the last 45 years and how our access has been improved. I'm going to focus on non-physicians named physician assistants and nurse practitioners who work alongside doctors and enhance the access to care when we need a primary care provider. And third, I'm going to talk about urgent care centers, which are available to us when we're sick at odd hours and we don't want to go to the emergency room and sit for 12 hours. On this panel, I might just say parenthetically, is a very handsome guy. He's my identical twin brother, Blair. Everyone in the room will already know that. I don't know if I should really have a green light on already, by the way. So when I allude to the fact that Blair and I went to Yale in 1970, I think people will know that, maybe more than some of you. To start a program in emergency medicine. Emergency medicine and the response to accidents in the 1960s and the 1970s was so bad in this country. It was called the neglected disease of society. In fact, it was said that if you were in Vietnam and shot up on the battlefield, you had a better chance of being taken care of promptly and efficiently by the excellent medical response team than if you had an accident at the roadside in our civilian life in the United States. So we came to Yale as part of a program at the Department of Surgery under a big grant to do something about it. We did a big study using the entire state of Connecticut as our laboratory because it's a small state, 35 hospitals, 169 ambulance companies, and we found the following. Ambulances at that time were essentially delivery vehicles. They were station wagon-like. And in fact, the whole idea was just to get you to the hospital, not to do anything for you. All you had to do to be an ambulance driver was to have a license. No medical training. My favorite of the 169, from a business model point of view, was one that was run by a funeral home. And picture this. You're picked up by the roadside by this hearse. Race to the nearest hospital. If you make it, you get a bill for the ambulance ride. If you don't make it, you go into Plan B. And somebody gets a bill for an even more exciting adventure. What a great business model. Actually not too good if emergency medical care is what you're after. When you got to the hospital, who did you see? Usually a broken down retired old doctor who was just hanging around for a few more years. No real special training in emergency medicine. Same was true of the nurses. Was there a central number that you could call? You had to look up in the yellow pages or white pages just to find how to get fire department or the police department. There was no 911 at that point. So we swooped in, our team, and said, we got to change all this. We set up 11 regions in the state of Connecticut with a central number that organized the whole system. We passed legislation in the state of Connecticut based on the study, and that passed in the next couple of years, setting up 11 regional emergency medical systems. We trained emergency medical technicians for the first time in the state of Connecticut in 1972, and we had CME courses for doctors. 10 years later, nothing that we really had much to do with, there are now training programs for residents and specialists in emergency medicine. So when you see a TV show now that's emergency or emergency room, you see all those handsome young guys and all those sexy young women who are doctors or PAs or nurse practitioners, none of them were around in 1970. They didn't exist, but they do now. So emergency medicine has been transformed. It's a third public service, much like police and fire. And we needed more manpower in general for primary care. And we were training more doctors. But it was very clear that you didn't need a doctor necessarily, this is solution number 2, to take care of a sick person. Physician assistants were starting to be trained at Duke in the 60s based on the experience of military corpsmen doing such a wonderful job with their training in the military. So we decided to set up a PA, physician assistant program at Yale, 24 months long, get a master's degree. And when I was back there 40 years later, last year, to do the commencement address, I was very gratified to see that there's been 1,000 graduates. We now have 85,000 PAs nationally. We have a parallel program training nurse practitioners, taking a nurse who's skilled and adding additional training. The total number is 200,000. So when you need a doctor, how many people have seen a PA? How many people have seen a nurse practitioner? You already know how well this works. The third is an urgent care center. Now, some of you may not be polite and organized enough to get your illness together in terms of 9 to 5 on Monday through Friday. You don't always get sick between 9 and 5 on Monday through Friday. I wish you did, but you don't. And you don't even have the consideration to skip the lunch hour. You might even be sick over the lunch hour. So most doctors' offices are open about 30 hours a week. I started an urgent care center along with a few of my doctor friends 20 years ago in Salinas. We're open 90 hours a week, every day of the year, holidays included. We're staffed by primary doctors, generalists like me, or PAs and nurse practitioners. You can come in without an appointment no matter what your problem is. So you have direct access to the medical care system. We're very inexpensive compared to the emergency room. If you went in with a severe headache to the emergency room, 12 hours later, CT scans later, you would have a bill, an astronomical bill. You come in to see us, we take care of you, we decide you don't need a CT scan and send you home with the proper medication. 20,000 visits a year at our urgent care center. Around the country there is a network of urgent care centers. So in closing, I would say that although there are a lot of problems still out there with our healthcare system, you see us compared unfavorably with 25 European countries, for example. But we have done 3 things in the 45 years that I've been in practice. One, we have a great emergency medical system. We have nurse practitioners and PAs who are skilled to work with doctors. And we have urgent care centers who are available to you 24 hours a day. Mr. Tisman.